Dito lang sa Barangay Canada.
My thanks to Judge Suzanne for sharing about her work, her career highlights, and her insights about the benefits of Canadian citizenship. Moving on to our second guest, she is Manitoba's Chief Occupational Medical Officer, as well as a Medical Officer of Health in Environmental Health and Emergency Preparedness. Also, she is a second generation Filipino Canadian public health specialist with training in occupational medicine and family medicine. Last year, she was honored among Canada's most powerful women Top 100 award. That was in the Canadian Tire Community Impact category. And she received the Canadian Occupational Safety's Top Woman in Safety Award. Later this month, she will be accepting yet another award in Prague, the Czech Republic. Here to tell us more about that is none other than the multi awarded Dr. Denise Koh. Have a look. Welcome to the program, Dr. Denise. Mabuhay.
Thank you so much for having me.
And it's an honor for Barangay Canada, the podcast, that you took the time to be with us right now after just winning your most recent award. I'm not going to spoil it. I'm going to let you tell us about the award. Go ahead, please.
Okay. Yeah. Basically, the Global FWN. So this is an organization which stands for Filipino Women's Network. So it's started in the United States, and then now it's a global organization. So basically, I got most influential Filipino woman in the world. So I got that title or that award in the innovator and thought leader category. So for 2023. So yeah, that's it's amazing. So
like I said, congratulations. But
thank
first
you.
of all, our viewers would probably like to know, are there others in different categories for this particular award?
Yes.
Okay.
Oh gosh, I bet you I can list some of them because I think I have the thing here. Yeah, there's a number of different categories. The innovator and thought leader was one of them.
So that's you for this year.
Yeah, well, like they have. It used to be, I think there was 100 people, like 100 women that they would celebrate. But my understanding is it's actually a lot less. So there's, I think, about 20 some this year. I don't think that there are that many categories. Like there's not one for each category. I think it's, if a person meets that category,
right. Yeah,
would get it. But
you don't just fill in each category, but if nobody qualifies,
I
then
think
that's blank for the year.
Yeah, I found out because I was wondering. The summit is coming in. It's in Prague and at the end of October. So I was looking at the schedule because there's a number of things I have to do for it. And I was like, how come there's not very many people? And so I asked the person who nominated me, and she said that, this year is, I think last year there was 20 something. Maybe this year is around 20, maybe even 19. I can't remember what number she said. Much lower. But yeah, so basically there's a number of different categories. I know there's one called Nicole, which is basically like somebody who has, I think, broken barriers or had enough, a lot of struggle to kind of get past. I can't remember the category. I'd have to look it up.
Yeah, no pressure there. The important thing is that you won the thought leader in innovation category there. So congratulations on behalf of a proud Filipino Canadian community here in the country. So you make us proud, of course.
Thanks.
And how special does that make you feel now? I mean, the last time I recall seeing the last time we saw each other was at the Independence Ball, this year's Independence Ball, organized by the Philippine Heritage Council of Manitoba, wherein you were, of course, the keynote speaker. Thank you for that. And you bravely shared your story there of the things that you went through, which we didn't know. And it was a common sentiment of all who were there, that it was visceral, it was gut-wrenching, but at the same time, it was inspiring because you overcame all of those obstacles, and now here you are. So now, given all of those struggles that you went through, how does this award, how does it make you feel now?
Well, okay, my first reaction was just I was flabbergasted. So I didn't even know that there was this organization or this award. And the person who nominated me was basically like, I have not met her in person yet. So this person basically found out about me and then basically, I don't know, went through the internet and found things about me. And then basically that's how she connected with me and asked if she could nominate me. So that part in and of itself was just crazy. It was like, whoa, I didn't even know that was a thing. So on that level, I was very shocked, surprised, flabbergasted, the whole thing. And actually winning the award, it really means a lot to me on a number of different levels. So on one level, I think for me, and I think, I shared some of the struggles that I've had. I really felt in a number of ways that I've been maybe overlooked for some things or under-recognized, a little bit undervalued in some of the work that I've done more recently. And it has been a struggle even from the past. So really having this award is validation that I sort of look at it and go, yeah, well, I worked really, really hard, and I deserve it. Like I deserve having the recognition anyway. So that piece of it feels really good because it is validation, which has been sort of, long fought for. The other piece of it too is it's a Filipina, right? It's not, Canadian. It's because I'm Filipina, which is like a really important aspect of it to me. That's it's a core, visceral, as you say, like it's, and part of it, I think, is because I was born in Canada. I don't speak Tagalog. I've always sort of relied on my parents to kind of in the Filipino community. And I think probably a lot of, like second generation Canadian, Filipino Canadians or Canadian Filipinos, might feel is just, it has never been really something that I've promoted much or has been promoted a lot about me. If anything, I'd be kind of grouped in with Asian. So like in medical school and in medicine, there's not a lot of Filipinos in there. So, people will recognize, oh, you're Asian, but they wouldn't necessarily know that I'm Filipino.
Not that specifically.
Yeah, exactly.
Okay.
So, and because I have some Chinese blood in me as well. My dad, people don't recognize me as Filipina. So that's another reason why it means so much more to me because, that's my upbringing. I grew up, yes, I was born in Canada, but I grew up in a Filipino household. And that's very, very different from any other type of household, really, like a Filipino, like the whole thing. So it's really celebrating that culture, and really it means just so much to me because that's who I am. And to have that recognition at that level is, it's mind-boggling, really. So I think that's important too. The other thing also that is another piece of it too is that this award is a working award. So as opposed to some of the other awards where they give you the award, you show up and that's it. This is actually one where we're supposed to pitch a project. So it's up to 2 years, 2-year long project, and it's supposed to uplift and support, empower, hopefully, Filipino women in my community. So it means so much to me on that level too, because even though it's harder to achieve, right? Like now it's like, oh, I have to do this thing. It's also important and it's very appropriate because Filipino women do need uplifting. They need supporting. They need empowering. And so it really is an organization that, really pushes to do that and pushes the awardees to figure out a way to do it. So that part to me is really important as well because it is a commitment. And it is a bit like a sisterhood as well. Like that's, I'm new still to it. I haven't met everybody in person. I haven't met anyone in person. Like I've done some, virtual calls and that kind of thing, but it's very much like a sisterhood. there's that support there. And I think everybody in the group kind of gets it, because I think most of the women there have struggled quite a bit to get to where they currently are.
Yeah.
So there's that
And
too.
you're going to be part of this sisterhood officially. When is that again?
Well,
When are you going to be receiving the award?
Well, October 29 is to November 2. So that is the
Okay.
summit, and the summit is occurring in Prague.
There you go. Wow.
Yeah. So I'm going to be going with my family, and we're going to go there.
Nice.
Yeah. And then that's when I'll meet everyone. And there's a summit every year, actually. So it is also a commitment to be a part of that and nominate a Filipina woman every year, a deserving Filipina woman every year. So yeah, it's also, I mean, that's another aspect of the award too for me, is that I think I might be the only one from Manitoba and Saskatchewan. So it's nice because it's opening up, right? Like, obviously I'm going to pick people who I know.
Right,
so
right. Yeah.
it also will help to uplift and, give the spotlight to a lot of the Filipino women in our community right now who are doing so much work and just not getting recognized. There's a lot of women like that in our community. So
I like it. I like that you pointed out that this award allows you to raise fellow Filipinas and have their achievements or accomplishments recognized, and that's very good. That's going to be very good for our community for sure. And now you're going to be part of this international or global sisterhood of achievers, right? And that's going to be in Prague. So wonderful, and I salute you for that. But you're also being modest, and I have to point that out, because last year you won 2 awards.
Yes, I did. I did win 2
There
awards.
you go. So that's probably how that person who nominated you found out about you, because your name has been floating on the internet.
Well, she did, but see, she was looking for Filipino women, and
Which you are.
Which I am, but
Yeah.
the gown I was wearing, had the butterfly sleeves, the turno. So
yeah.
a gown that was made specifically for that award, but also to represent my logo and who I am, so my roots. And yeah, the story behind that is actually one of my close friends that I grew up with in Regina. He is, a pretty fancy designer in Toronto. So I was able to connect with him, and he made my gown for me. So we made sure to have butterfly sleeves.
I'm thrilled about your travel to Prague to receive this award, and congratulations again. But that's not the only thing that is special in the coming days, because you also have a book launch, right?
I do.
Tell us more about this book.
Okay. I'm gonna I'll show it to you, because I'm
ahead, yeah. Show us.
I don't know if you can see it. It says,
we can see it. Yeah. So AI. So that's very current right now. Well, current.
So it's basically AI, artificial intelligence in medicine, a compilation of stories from doctors across multiple disciplines on AI breakthroughs, challenges, and potentials in the healthcare system. So it's a compilation. So if you see here on, I don't know, I have to maybe go closer.
Right. Yeah. So there's 15 photos there.
15 of us female physicians. They're actually, all of them are from the States except for me. I'm the only Canadian in the group.
You're representing.
Yeah, and I'm also representing because I'm the only public health and occupational medicine as well. So
nice.
It's nice because I'm featured in the book, and with this collaboration, we had one physician who's an author who's written books before, and she was the one who facilitated us getting together and sort of organizing us, which is very difficult to do with 15 extremely busy women.
Oh yeah.
Doctors running around doing all the things we have to do. She was amazing at really just getting us together and making sure that we stuck to the deadlines and whatnot. So each of us wrote about the potentials for AI from the lens of our own specialty. So I wrote about the pandemic, my experiences through the pandemic. Also talk about some of the struggles that I've had.
That's how we knew each other, because you were a guest
That's
in
right.
one of my episodes during the pandemic, if you remember.
Yes, I do remember that. I remember
Yeah,
because we about the REI report. So
that
I
was
actually,
our first virtual contact.
yeah, and I mentioned it in my chapter actually.
Oh, you did? Okay.
Yeah, well, not specifically you, but I mean, more
That's fine.
about the REI stuff. So the race, ethnicity, and indigeneity, data that was
Yeah.
basically showing that the racialized
Yeah.
people are disadvantaged. And so I talk in my chapter about how the data that we pay attention to as an organization, so government, and not just government, but all the systems, if you only look at certain parts of the data, then you will miss, you could potentially miss a lot of other things. And then if all of the policies come from the data that you're only looking at and ignoring certain other pieces of data, then you end up with racist policies, essentially, right?
Right. Right.
So it's so important to be able to really think about the decisions that are being made and also what information is leading to those decisions. So that was a struggle that I had a lot during the pandemic. Was I really noticed that the information we were capturing was not good enough or clean enough to be able to make some policy decisions. And in some cases, actually, the data was, pretty good at showing that there were inequities, but they still weren't making those decisions. Like they weren't flowing to the actual policies. So, for
Right.
instance, eligibility, an argument could be made that they could have had lower age ranges, because remember, we were only going by age for the longest time,
Yes.
and there's certain groups that were starting to show that they were
Hmm.
having worse, like severe outcomes, or they were more likely to get the infection. So
Hmm.
what I was trying to argue for was, well, no, you should do that in the workplace. We should make sure these groups of workers get vaccinated first.
Yeah.
So
Frontliners are a majority of the frontliners are Filipinos because it's a cultural trend of ours to have Filipinos work as nurses and
exactly.
medical healthcare aides, right? And I
No,
appreciate all those points that you made during that time because I also cited them when I had conversations here in Steinbach. Like you have to listen to Dr. Denise about what she's saying about these findings. So thank
it,
you for that.
it's
And
very,
but yeah, go
yeah.
ahead.
No, just that it's very striking if you really look at and pay attention, um, yeah, to the data, that it's like, well, an argument can be made, we should be doing something now, and I kept raising those issues and they were not getting addressed. So that was part of the problem. But then the AI, going forward, AI can be useful in helping to close those gaps a little bit. So that's
I
part
was
of
gonna
what.
follow up about that. Like, how are you gonna relate AI to interpreting those findings, interpreting them correctly, right? Not
Yeah,
or more thoroughly.
EI is essentially a tool that we can
Mhm.
use. Um, I mean, there's so much like things that have come out of that. So it's expanded so greatly. It's
Yeah.
been very explosive growth that we're able to do a lot more, and do it very, very quickly. So data is a huge issue because we're slow in terms of how we get the data, manage the data. Sometimes it's in paper form, that kind of thing. AI
Yeah.
can really use there to, it can go through text, for instance, to make sure that the data is, clean, and that you can actually compare it to other pieces of data. So you can actually use AI for that. You can use it for capturing data. You can use it for electronic health records.
Yeah.
And it also is good for analyzing large amounts of data. So if let's say you're looking for a particular thing, like looking for trends in data to determine that, yes,
Hmm.
there's a pandemic or something coming that's
Hmm.
unusual, it can actually detect that. You just have to
Yes.
link it to the appropriate data sources. So there's lots that can be done um, within healthcare and AI, particularly with a pandemic, and also with some of the racist, some of the things to make it less racist, shall I
Oh, yeah.
say? Oh
Yeah.
yeah,
So to avoid like misleading conclusions, right?
Right.
Now, I'm sure people are intrigued by what's in that book. Can you tell our viewers like when's the launch going to be and other details about where they can avail of this book, Doctora?
Yeah, I can give you the link. But basically, like it's out right now on Amazon, Amazon.com and Amazon.ca.
And
Um,
I'll flash the poster here as well while you're saying that.
I will
Go
send
ahead.
that link. And then on Wednesday, October 17 is the launch. So
Mm,
on that day, there should be a link that I get that I can send to you on the 17th, and that they should actually be free download. So right now, I think it's 99 cents for a Kindle download. And I think it's about like $20. It's less than $21 if you order a paperback copy from Amazon. Then I'm also have author copies that I will eventually get, and then I can sign them, and if people wanted to get them from me, they can also do that as well.
perfect. Perfect. I
But yeah,
myself am tracking this rapidly developing AI trends. Like seems like every day there's
yeah,
something new about AI, right? It
yeah,
started with Chat GPT, and now it just like exploded into so many different platforms. It's
exactly.
it's impressive, but at the same time, it's kind of scary
Yeah.
because you don't know if you're going to be replaced anytime soon.
Well, that's true. It's a common, fear is a common thing a common reaction to have with anything new. But really, it's a tool, and it's expanding so quickly that really what would be the worry that you would have is if you didn't use it. So it would never really replace us as humans, and that's what a lot of what the book talks about, is that there is a human element that is crucial, especially in
Right.
healthcare, in a lot of other areas like the arts, etc. But using that will help, can really help a person become way more efficient in their work. It can help with detecting things, so it can take off the sort of the legwork and some of the detail oriented stuff related to the data, for instance. That can actually you can push that off and give that to technology, and then people can focus on more the people things. So for
Right.
instance, here it could be like interactions with patients, which is such an important part of healing.
Yeah.
Just the numbers and the diagnosis and the medicines and whatnot. It's also about being cared for as well. So
I
yeah.
totally agree. And so you're a multi-awarded medical professional. You're an author, published author twice over, because you came out with a book about of course, your very well-known father, the late Dr. Eusebio Koh. And now you have this book coming up, launching on October 17. But you also developed an app, right? Tell us more about that app.
Yeah, it's the MedResRx app. So you can find it. You can find the Passion Web app if you go https:// and
Mhm.
then ResRx. So MEDRESRX and then .passion, like the word passion, PASSIO.io. So I can also provide you that link.
And I'll
But
flash the maybe the QR code here or the URL, so it's
okay.
easier for our viewers. Yeah.
Yeah. And so basically what I did was it's basically to reflect my really busy and quite successful hypnotherapy, psychotherapy, and life coaching practice. So I was making a lot of gains with my patients, but the only problem is that there's only one day a week really that I could do that work. So what really my patients need, or the clients need, are the recordings that they can listen to every day. Then they really see great benefits. So basically that's what I did. Was I created this app, and I'm putting all of my recordings onto there. So I'm going through a process to do that. Yeah. And so that way, anyone, anywhere, at any time can listen to the recordings, which is really important for people, especially people who are extremely busy and they don't have time to be waiting, to coordinate a time that they're available when I'm available. They can listen to it like in bed, at home, anywhere. Um, it's not all hypnotherapy. So there are some motivational recordings that they can hear, like when they're on their transit, like when they're driving to work or,
Right.
on a bus. So
Yeah.
there's some really good messaging. Everybody needs to have good messaging in their ear at all times, ideally, but at least to combat some of the negative messaging that people pick up in a day, which is normal.
And there's a lot of that these days, right? This is available on the App Store and on Google Play as well.
It's on those as well, but I still recommend the Passion web app because that's the one that's the most up to date. Every time I do it, it has to go through a process to get approved. But on the Passion web app, it's there right away. And there is a way you can get that symbol and put it onto your phone, so it acts like an app. So that's what I do. I use it all the time on my phone for my.
Well, just check it out to our viewers. So you're a multi-awarded medical professional. You are a published author twice over, and you also have an app like we talked about. So, Dr. Denise, what kind of message would you like to leave our viewers out there, our kababayan, our kabarangays, coming from somebody like you? Go ahead.
Well, I mean, first off, I'd say that, being successful, it's usually the most recent thing, because before that success was probably a lot of failures to get to that point. So, by saying that, I mean, if you're struggling or if you're, feel like you're not getting where you want to be, that doesn't mean to give up. It means to keep going. And so you have to try different things, and you have to put a lot of action towards things to achieve that goal. So that's one piece of it. The other one is around just looking at one's own limiting beliefs. So think about the messaging that you're taking in. So if you're not somewhere you want to be, think about, or like if you haven't achieved that goal, let's say, or if you feel like you've had a number of failures and it's frustrating, that's not the time to give up. But it's important to also look at the messaging that you've, taken in. So accepted, or you tell yourself, if it's like, oh, I'll never do it, or, I'm a failure, or things like that, it's less likely for you to achieve that goal. So it's always important to use the messaging to something that's going to empower you. So anytime there's a failure, you have to turn it around to make it something that's going to push you towards the goal instead of pulling you away. Which is what I do with my patients and my clients with hypnotherapy. But yeah, the messaging is a big thing. And I found that I've done that a lot in the past, and I still do it. So I still listen to my hypnotherapy as well to help move forward. So I think those are a couple of the things that are really important, and also just to also be connected to your why. So this is, the reasons why you do things. Make sure that your goal that you're trying to achieve has a strong base of why, to like who you are as a person, because that really helps you to figure out a way. Your brain will figure out a way to kind of make those things happen if you have a strong enough reason. So I think I mentioned it before, if you have a strong enough why, you can handle any how. So it's the same thing, right? So I think those are a couple things that I would want to leave.
And I like it. I really appreciate that you share that. That's all coming from your experience, of course. So I'm sure a lot of our kababayans out there will find inspiration from your words of wisdom right there. Thank you very much, Dr. Denise. And I wish you safe travels, you and your family, when you receive your award in Prague. And next time we see each other, I'm going to get your autograph. I really do need to get your autograph. So I'll see you next time. Mabuhay uli. And thank you.
Okay. See you.
Thanks again to Dr. Denise Koh for taking time for the podcast and share about her recent accomplishments. She's truly an inspiration and a source of pride for the Filipino community here in Canada. And that wraps up another episode of the podcast. Thank you for watching and for your continued support of Barangay Canada. Mga barangay, this program is for you. So feel free to like and share it with our kababayans across Canada. See you in the next episode. As your Kabarangay Kris, let me say, maraming salamat At paalam po muna.
Dito lang sa Barangay Canada.